Herpes simplex virus, HSV, known as herpes, is a common infection that can cause painful blisters or ulcers. It primarily spreads by skin-to-skin contact. It is treatable but not curable, or so we are told. There are two types of herpes simplex virus. Type 1, HSV1, mostly spreads by oral contact and causes infections in or around the mouth, oral herpes or cold sores. It can also cause genital herpes. Most adults are infected with HSV1. Type 2, HSV2, spreads by sexual contact and causes genital herpes. Most people have no symptoms or only mild symptoms. The infection can cause painful blisters or ulcers that can recur over time. Recurrent symptoms of both oral and genital herpes may be distressing. Genital herpes may also be stigmatizing and have an impact on sexual relationships. However, in time, most people with either kind of herpes adjust to living with the infection. HSV infection causes several distinct medical disorders. Common infection of the skin or mucosa may affect the face and mouth, orofacial herpes, genitalia, genital herpes, or hands, herpetic whitlow. More serious disorders occur when the virus infects and damages the eye, herpes keratitis, or invades the central nervous system, damaging the brain, herpes encephalitis. People with immature or suppressed immune systems, such as newborns, transplant recipients, or people with AIDS, are prone to severe complications from HSV infections. HSV infection has also been associated with cognitive deficits of bipolar disorder and Alzheimer's disease, although this is often dependent on the genetics of the infected person. In all cases, HSV is never removed from the body by the immune system. Following a primary infection, the virus enters the nerves at the site of primary infection, migrates to the cell body of the neuron, and becomes latent in the ganglion. As a result of primary infection, the body produces antibodies to the particular type of HSV involved, which can help reduce the odds of subsequent infection of that type at a different site. In HSV1 infected individuals, seroconversion after an oral infection helps prevent additional HSV1 infections such as whitlow, genital herpes, and herpes of the eye. Prior HSV1 seroconversion seems to reduce the symptoms of a later HSV2 infection, although HSV2 can still be contracted. Many people infected with HSV2 display no physical symptoms. Individuals with no symptoms are described as asymptomatic or as having subclinical herpes. However, infection with herpes can be fatal. Key facts: an estimated 3.7 billion people under age 50, 67%, globally have herpes simplex virus type 1, HSV1, infection, the main cause of oral herpes. An estimated 491 million people aged 15 to 49, 13%, worldwide have herpes simplex virus type 2, HSV2, infection, the main cause of genital herpes. Most HSV infections are asymptomatic or unrecognized, but symptoms of herpes include painful blisters or ulcers that can recur over time. Infection with HSV2 increases the risk of acquiring and transmitting HIV infection. The name is from Greek, herpes, which is related to the meaning, to creep, referring to spreading blisters. The name does not refer to latency. It's obvious some patients with herpes are being enslaved to the antiviral and other supplementary orthodox medicine just to help suppress the virus and not a cure. Fortunately, HSV1&2 is curable with natural herbs. This is a very informative page for anyone who wants to get cured. Dr. Eze Odogwu, a herbal doctor, uses herbal remedies to cure HSV. All given information are highly recommended to any and everyone who needs this cure. You can contact the good doctor via email ezeodogwuherbalhome@gmail.com or WhatsApp +234 7018157305. Facebook https://www.facebook.com/profile.php. id equals 61,560,368,581,969 and mybexted equals LQQJ4D.